and welcome to another episode of Vital Times, the CSA podcast. I am your host, Rita Agarwal. In my last two podcasts, we talked about gender and sexual harassment, and one of the reasons we felt that it was important to shine a spotlight on the topic was because of the potential increase to burnout and career dissatisfaction. Today, I wanted to explore the benefits of mentoring, sponsorship, and coaching to improve satisfaction with the workplace, increasing retention of personnel, and mitigating burnout. Mentorship has long been recognized as a critical component of training physicians and training physicians in their subsequent careers. Benefits of mentorship in medicine include increased productivity, improved career satisfaction, expansion of professional networks, reduction in stress, and better work-life balance. Mentorship has also been shown to aid recruitment and retention of a diverse physician workforce. The establishment of mentorship programs has been proposed as a mechanism in promoting inclusivity and diversity within academic medicine, but setting up successful programs can be really challenging. I am joined today by three accomplished anesthesiologists at different stages of their careers and from different backgrounds to discuss the benefits of good mentorship programs and how to set them up. We also discuss what a good mentorship looks like, specifically good mentorship looks like, and how to start successful programs in both academic and private practice. Dr. Scott Markowitz is a professor of anesthesiology and vice chair for professional development and diversity, equity, and inclusion at Washington University in St. Louis. Scott's office develops initiatives to measure departmental cultural engagement and well-being and has produced, curated, and supported programming to promote engagement, resilience, professional development, and an increasingly diverse and inclusive leadership environment. Scott focuses his administrative work on leadership development, promoting a diverse, inclusive leadership and workplace, and promoting meaningful engagement among department members, as well as building leadership skills and capacity for every member of the department, including faculty, the staff, and the administrative staff. He serves on the ASA's ad hoc committee on harassment, incivility, and disrespect, and works closely with other leaders on the national initiative Raising Anesthesiology Diversity and Anti-Racism, also known as RADAR. Scott has a vast experience with a variety of organizations, including the LLUMC, the Women's Empowerment and Leadership Institution through the Society for Pediatric Anesthesia, and the University of Colorado, teaching communication skills, conflict management, and as a certified executive coach. Welcome, Scott. Dr. Ioana Pasca is an associate professor and associate program director and director of Neuroanesthesia at Riverside University Health System. She also is a neurocritical care faculty member at the Loma Linda University Medical Center. She's at the UCR School of Medicine Adjunct Associate Professor and an Anesthesia Interest Group Advisor. She's also a UCSD clinical instructor. She's going to be the co-chair of the CSA's annual meeting next year in Anaheim, California, at Disneyland, and the vice chair for Critical Care Abstracts Committee of the ASA. Dr. Paul Yost is the ASA Assistant Secretary, past CSA President, and past ASA Director. He did 2 residencies, one in pediatrics at Jackson Memorial in Miami, and anesthesiology at UCLA. He's boarded in pediatrics, pediatric anesthesiology, and adult anesthesiology. Oh, and he says that his boards in peds have now expired. He worked at Children's Hospital of California,
Orange County,
and St. Joe's in private practice for 32 years. He served as the chair of the Peds Anesthesia Department at CHOC, chief of staff at CHOC, and co-director of Peds and Adult Cardiac Anesthesia. He also served as director of pediatric pain at CHOC. Additionally, he served 10 years in city government, including 8 years on city council and a couple of terms as mayor of Seal Beach. Additionally, he served on Cal Optima board and 4 years as chair overseeing a 3.6 billion in Medi-Cal funding for Orange County patients. Most importantly, though, he was my he and I were classmates in medical school. So I want to welcome Doctors Pasca, Yost, and Markowitz. And I want to start with a really simple question, and that is to ask each of you, what brings you personal fulfillment, and how did coaching, mentoring, or sponsorship have any impact on that? And I'm going to start with Dr. Pasca.
Rita, thank you so much for having me on this podcast. I'm really excited, really to get to work with all of you, because for me, fulfillment really started through the CSA, realizing fulfillment by being mentored by a lot of really wonderful women, first on the Women's Task Force, and then through the educational program division through the CSA. I have been the associate program director and working with medical students, residents, helping other people along their career pathway is really what's brought me a lot of fulfillment in medicine. It was really interesting doing critical care and anesthesia and wanting to be a doctor. It's really incredibly fulfilling to work with patients, but helping people along the journey has really been what's filled my cup. Writing letters of recommendation, pointing people in the right direction, getting people onto committees, and helping people when I saw them really have that empty cup by joining these different committees and finding these different mentors has brought me a lot of personal fulfillment.
Thank you. Dr. Yost.
Thank you, Rita. It's thank you for including me. This is an absolutely wonderful panel of experts. For me personally, what gives me satisfaction is being involved in something that's greater than myself, and obviously, I've found that within organized medicine. I've always been involved and stayed involved and tried to do a good job, and then I find that people kind of ask you to do more. But I really feel that it's the job of every leader to try to train and to work to see people replace you and to find a way to find your replacement. And that's what gives me the greatest satisfaction personally, within for my life anyway. That's what I found.
Dr. Markowitz.
Hi, thank you, Rita. Thank you so much, and to the CSA for creating such a wonderful podcast and an opportunity to talk about these topics. Professionally, I think my biggest personal fulfillment comes from the continuum, as my colleagues have said. Taking care of patients and families is absolutely rewarding, and also taking care of other professionals, supporting others to thrive is how I would summarize that. And these are areas that I think we all find rewarding.
Great. What do you think a group or an organization's responsibility is in supporting professional fulfillment, if any? And how does that differ in private practice versus academic practice? I'm going to start with Dr. Yost because you're the only one of us who has done private practice for most of your career.
Yeah. Mentoring in private practice is incredibly crucial. It's hard for us to bring people into our practice, especially early on, because you had to do both peds and adult anesthesia. And it was hard for us to find people like that. And we wanted to keep them and to make sure that they fit into our culture, that they survived and they thrived. And so what we would do is we would assign somebody from our group to sort of shadow that person and to talk to them, because sometimes there's a big jump in coming from an academic setting to a private practice setting. All of a sudden the pace is a lot faster. There's a little more production pressure. The relationships between the surgeons and the anesthesiologists is very different. It's a little bit more collegial. It's a little bit more kind of like your friends working toward the same goal, as opposed to potentially being a little bit more adversarial that I've seen coming from academics, at least back when I was training quite a while ago. But for us, it's really important that the people are happy and that they do survive. And in the rare instance where it may not be a good fit, having someone who is a trusted advisor who can talk to this person and find a way to make a separation that's beneficial for everybody and doesn't hurt anyone in the process, I think is very beneficial. And what we found is that people who are better mentors tend to be of a similar age, similar demographics, some similar background. I end up getting people who come to me because they want to be involved in CSA or Orange County Medical Association, or get involved in organized medicine or in areas outside of practice. And I get looked at as a person who has that experience and that kind of expertise. But for us in private practice, although it's not formalized, it's in the sense that we write down everything that a mentor does. It's really critical for us. And for us, bringing somebody in, we want them to succeed. We really do, because we want the surgeons look to us. And if somebody comes in and they're part of our group, they need to know that this person can handle the case and can do it in the way that they're accustomed to, an allied anesthesiologist doing that case and doing it professionally and doing it well.
Thank you so much, Dr. Yost. I'm going to go to Dr. Pasca and let Dr. Markowitz finish up, since he is someone who has set up and seen both unsuccessful mentorship programs as well as hopefully now successful mentorship programs. Dr. Pasca, what do you think? And I know you've also shared that you've been in programs that were not so helpful to you as an early career faculty, to where you feel you're in a place now where it is much more positive.
Right. And this was something I was actually speaking to Scott about earlier, is that really, I think it's hard to recognize those mentors. So every physician anesthesiologist that you lose from any institution is going to be upwards of $500,000 to replace. They're extremely expensive. The value and the experience that we bring for improved patient care, improved efficiency in the OR, understanding systems is tremendous. And so whatever we can do as an institution to keep people on will be beneficial for everyone involved. But like Dr. Yost said, it's sometimes really difficult to find people of similar backgrounds to pair you with. So being a physician who had a young family, I had my first child during medical school, my second one during residency, my third one during fellowship. And I'm also first-gen American and of a sort of different background. And it was, I think, hard for me to relate to people and hard for me to build those relationships that you really have to build with mentors. The networks, finding that sponsorship, I think was difficult for me, not because it wasn't accessible and because it wasn't there, but because I didn't know how to build it. And I think that's something we really have to critically teach people to do.
Thank you, Dr. Pasca. Dr. Markowitz.
Oh, thanks. I have to agree with both of my colleagues. And I think that the issue really is how an organization has a responsibility or can support these things. And one of the things that an organization can do is help to influence the culture locally, so that people are treated with and treat others with respect and see each individual within the organization as just that, an individual that has many things to offer. And so an organization in that setting would make available professional development opportunities or make available time and encouragement for those things to happen. And that will include a mentorship program, reinforcement for that, ensuring that the mentors are trained and accountable, ensuring that the mentees have the information they need to help drive the relationship, and the support that they get by example from the leadership. Also, early identification and support for correction if the culture or an individual are not fitting well for things, as well as these idealized examples. I think that there are also some very simple practical things, such as looking at equity within the department or group, and also looking at opportunities that come from the group members to identify areas for either improvement or building upon success.
Would you mind expanding a little bit on, like, an example that was just to sort of better for us to better understand?
Sure. I think that the group leadership or the department leadership are in the best position to say that mentoring is important and that doing it well is helpful. And so creating systems in which maybe assignment, maybe some voluntary, and some accountability on it. And so having, when a new person joins, especially as I think that we're really focusing right now on the transition for maybe more junior members into the group and into their career launch, to have someone assigned, to have someone that matches in ways that are important, to have options for additional people to be available, to have the mentee to be able to drive whether that relationship is successful, and also if there are other relationships that they need to develop, and then to have time and space provided for those things to be able to be leveraged, such as if there's a particular skill set that is needed, a training program that would be helpful to set up the timing and the cadence for personal growth early on.
Thank you so much. I want to I want to actually pick up on one thing that you said, and that was mentee accountability. I know for myself, when we first started, I never had really formal mentors. That concept didn't entirely exist. It was a much more, and this is probably true for both Dr. Markowitz and Dr. Yost as well. I'm guessing that when you first started your early careers, you kind of went to the senior people in the group that you knew and liked and that you worked well with. And there was really not a concept of this formal mentorship program. I know over the years while I was both at mostly when I was at the University of Colorado, since that was where my early career was, we had made several efforts to start mentorship programs long before Dr. Markowitz joined the group there when he was there. And, they were abysmal failures. And I think one of the things as I think back on it, and in light of what you just said, is that I don't think we had accountability built into the program. It was more like, okay, you're going to mentor X person. And, at the end of the year, tell us what you've achieved, or, something along those lines. It was very vague. And I think both as a mentor and as a mentee, I think there was a lot of confusion as to what that role was, particularly if it was someone you weren't that familiar with and it was someone you didn't know that well. I mean, I think everyone wanted to do the best that they could, but they weren't able to. And I'm just curious, Dr. Pasca and Dr. Yost, did you have experiences like that throughout your careers?
Well, I would say, yeah. I mean, just recently, I kind of had a transition in my practice. I went from being at a children's hospital and an acute care adult hospital to doing locums and in surgery centers in Santa Cruz. And I had a mentor, and he was awesome. Yeah, he was
Yeah.
an older person. He was actually the brother of somebody who was in my group. But it was fabulous because he helped me with the particulars of the EMR that was a little different from the one that I had used in the past. And he would kind of counsel me. I'd call him the night before and he would tell me, what types of blocks certain surgeons would like and others would not like, and, and how things would work. And it made my transition into the group just so much smoother. You really helped me. You look much better than I am. and I think that's something that's key for a mentor. But I think it's not always that. In early in my career, I don't know if I had a specific mentor, but I did kind of what you talked about. I talked to the people in the group who were older, who'd been there for a while, and got some of their advice as to what to do and how to fit in. That we didn't have anything really formally set up until much later when we realized we really needed to make sure that our newer people came in, stayed, and fit in seamlessly and were productive members of the group, and that they were happy and they were going to stay.
And did you build in, Dr. Yost, accountability into that relationship, or was it still, I mean, I
In a
know
sense,
recognizing private practice is different.
yeah, in a sense, yes, because we're pretty communicative and we kind of check in with one another with the group leadership is how is this person doing? Are they doing okay? And we would speak with the mentor and we'd speak with the person and, do we need to make any interventions? Do we need to do anything? Is this person gonna do okay here? Or do we need to see if we can, find another place for them or another home? And we did have to do that a few times. I think I remember the failures more, but they ended up being ultimately successes because of those people that didn't fit in, they all went on to other practices and were very successful in those practices. One went to an academic children's hospital, and another went into another academic institution. But they did very, very well and have had wonderful careers. But finding a way to make all that happen, I think, is important, and it does take communication, although it wasn't formalized. But in a way, it was. We were constantly aware of how we're going to, handle our workforce, because we're all short. we all need people. And we all want to keep high quality people.
Thank you, Dr. Pasca. Did you experience accountability as any of the parts of the mentorship programs, either as a mentee or a mentor?
I've never been part of a formal mentorship program for myself. I have put on multiple mentorship programs for my residents, and I think that it's really incredibly difficult, to quote something from Dr. Yost's paper, to standardize, evaluate, and to monitor mentorship. And I found that it's been really difficult even for my residents. I've created these family pods for next year, trying to partner people with similar backgrounds who have had similar sort of trajectories to try to help each other and different levels of learning. One of the things that really stood out to me was going to SOPM, to the Society of Academic Anesthesiology program directors meeting. And one of my letter writers was actually the president of SOPM for a couple of years. And I said, wow, I actually stopped him and I thanked him, for building my career trajectory and helping me along the way and actually mentoring me when I really didn't understand what mentorship even was. So, I agree with you, Rita, that, really early on and many years ago, we didn't understand the concept of mentorship. We were just kind of doing it. And so there wasn't this accountability because it wasn't an expectation.
Got it. Dr. Markowitz, anything else you'd like to say on the topic before we move on?
Only to say that my thinking on that was the responsibility of the organization, but the individual's responsibilities in this are paramount, and in most settings, it's what drives it. So, Dr. Pasca, for example, finding a mentor, recognizing mentors in the relationships that are helping her developmentally, and same with Dr. Yost, and maybe this onboarding buddy that you had is not necessarily part of a formal accountability part of the program, but one has an expectation of an outcome from that, and to be able to use your skills to help influence that is a personal level of driver for, bless you, for success.
Sorry.
Yeah, bless you.
What barriers, and we can say broadly, have you experienced in your careers that hindered your personal growth, or have you seen create problems for others? And I think this time I will start with Dr. Markowitz.
Well, I know, Rita, you know these stories better than anybody. I'm going to tell a Reader's Digest version of it, but the truth of the matter is that having less attention to my formal development in the areas of communication, leadership skills, and interpersonal skills, as well as teaching capacity within different environments in which we work, each of these had created limitations for me, thinking that I needed to deliver on something for which I wasn't well trained and didn't know it. And so the lack of mentorship in some of those areas was really noticeable once I hit a ceiling, once I recognized that. And in some of those, it was interpersonal skills and that lack of self-awareness that came with it. Fortunately, at each of these times, there was someone who was looking out for me or recognized the pattern and offered a pathway to growth or to learning. And I think that was the kind of trial and error that a lot of places have used over time to kind of just in time mentoring or coaching. And so for me, that was, I think, where I kept stubbing my toe until I started to have a systematic approach to my own learning and development.
Dr. Pasca.
So barriers to mentorship, So there was actually a really great article from ANA that was talking about the qualitative study of women and leadership acquisition. It actually asked women leaders, 26 women leaders from across the country, what they did really well. And we suffer a lot from imposter syndrome as women. I think that we have a really difficult time letting go of our previous failures and sort of adapting and just moving forward and just saying, okay, well, we all will fail at some point and do things inadequately. I've read tons of books trying to somehow find adequacy, and I keep saying yes to everything because I'm afraid to miss out, the absolute FOMO. So I think that has actually been both a curse and a blessing, as it's sort of opened all these opportunities for me to just keep exploring other areas of potential growth.
I would say,
Okay, great.
I would
Dr.
say,
Yost?
I would say, imposter syndrome isn't limited to women. I suffer from that hugely. I mean, it's like, yeah, I'm always feeling like I'm inadequate, especially if I happen to have something unfortunate happen in the OR. One of my attendings said I would flagellate myself for weeks. But yeah, I don't think that that's specific to a specific gender. In terms of limitations, I think sometimes, like, I'm thinking of the situations within my large private practice group. I think finding someone who was a good match is sometimes hard, demographically, gender-wise, where they are in relation to raising families. I think that can be really hard, and I think that led to some separations that didn't need to happen. I think we were not able to make people feel as comfortable and secure in our environment as we could have or should have or would like for us to have done. But by and large, I think we've done a reasonable job, but I think those have been the major limitations. And then me personally, I don't think there were many people that were following my career path. So it's hard to find mentors who are
Not
like,
many mayors.
no, not many recovering politicians. I call myself,
Not many recovering politicians.
it's a 12-step program. Problem is I'm only on step 6 because I'm elected the ASA assistant secretary. So I guess I'm not really completely out of the field. Anyway.
That's, I just want to, sorry, you brought up the imposter system, and I'm just going to stop for 1 second. Hang on. Sorry, I'm going to pause it. Imposter syndrome. Okay, so the three of you brought up something really interesting, and that's imposter syndrome. And I agree with Ioana that as women, we definitely think that we suffer more from that than men do. And it's really interesting to hear the two of you saying that it also exists pretty strongly for men. So I'd kind of like to explore that a little bit more. I mean, for me, imposter syndrome always was the sense of somebody else could have done this better. If I miss a line, or I miss an airway, or I have a not so perfect outcome with a patient, there's always that spinning, even now after 30 years, spinning around in the back of my head as if, so and so had done this case, could they have avoided this complication? For me, right now, it's really around a lot of the ultrasound skills, which, Paul and even Scott, our generation didn't really grow up learning. We've had to learn it on ourselves. And I see these residents who can't start a blind saphenous to save their lives, but give them an ultrasound, man, and they can put anything anywhere. And I'm just like, oh, wow, I can't do that. So I'd love to explore imposter syndrome, and maybe how mentors or good mentors can potentially affect that. Let's start with Dr. Yost.
Sure. Yeah, no, I think that's definitely the case, because I know when I've had difficult outcomes, one of the things I kind of worked on doing within my own private practice group, I had a really difficult, challenging amniotic fluid embolism when I was really early in my practice. And after that, every woman who was pregnant looked like a time bomb to me. It was like I had PTSD for the longest time. But I had a couple of really good mentors that took some time to talk to me. And as a result of that, one of the things I wanted to do in my group and tried to do was to set up sort of a disaster management group of people that included people who were older, somebody who was the person's mentor and trusted, and someone when something bad happened could take the person, make sure they're okay, and then help them with things like completing their chart, making sure that they included everything that they could, making sure that they understand how to deal with a very difficult situation and looking after that person personally. And then following up with that person in the days and weeks and months afterward. And I think that's all, really, really critical to that. And I think having a trusted mentor who's helped you through your group can help in those really difficult situations and can help make sure that, we don't have more than one victim of a situation, that we are able to keep that person a productive member of our group and able to continue to provide care for people.
Dr. Markowitz?
Oh, yes. Having a bad event for a patient early in your career has a host of challenges that can go along with it. And one of the things about the imposter syndrome is that there are two elements. There's how I see myself as capable and or worthy, and how I think others see me in the same light. And I think that is an area in which there may be a substantial gender difference. How I am perceived by others may be different than how a woman in my position might be perceived in that same set of circumstances with those same outcomes or similar behaviors. And I think that's an area that is, I think, probably gender related. From the perspective of what happens when the bad outcome occurs, I think that's very destabilizing to my own psyche or self-esteem. And I think that's a real challenge early in your career when many people may not know whether to give you the benefit of the doubt. Oh, that's so-and-so. I know they must have done everything possible and this was unavoidable, versus, oh, I don't really know them very well, but I guess it's possible they made a mistake or had bad judgment. And when that happens, and no matter which direction it goes, you may not know yourself, but when that happens, it really helps to have someone who you can trust, who knows the big picture, to be able to say, you did everything you could, or, you have good lessons to learn from this and you're okay, this happens. Or I am going to advocate on your behalf behind your back in these other rooms where people are saying things that aren't necessarily true and leading to assumptions that may cloud how they see you in the future. And frankly, I've had all of those things done for me in the past, and I have done my best to make sure that I'm there for others, because those things happen, and how people perceive them plays a big role in how I am seen or how that person is seen down the road.
Oh, that's great. Thank you. Dr. Pasca, take it away.
Wow, I am just floored that you all had early disasters that you dealt with. That was so formative.
It continues. Imposter syndrome doesn't go away completely.
But I just wonder, Dr. Markowitz, you just spoke very briefly about how people deal with those early disasters. Can you speak some more on that? Because really, I'm very interested that all of you had these issues that you kind of carried with you for a really long time, similar to myself, right? Which is why mentorship is so important to me and why I find so much fulfillment from helping others get through those difficult times.
Well, thanks. I can remember distinctly a particular situation I was thinking of when this happened. And it was in my first year or two of practice after fellowships. And there was an event that occurred. And during that event...
Can you repeat that? Sorry, it cut out just briefly.
Sure. In the first year or two, there was this event that occurred that was just a huge surprise and a catastrophe. And we managed to resuscitate the patient to the ICU, but the consequences of this led to a bad outcome days later. And in that, I was second guessing myself, but I had been there. I had known what was going on, what information we had, what decisions I had made. And I had, after a day or two on my own, come to the conclusion that I couldn't think of anything else. But in that same time frame, I'm talking to the experts in my group and laying it all out there. And I'm a pretty good sharer, as Dr. Agarwal can tell you. And what ended up happening was that someone realized that there were other people who hadn't been part of those circles who had made the assumption that what had led to that was a bad decision on my part. And given all the circumstances, I didn't feel that, but it was about to sabotage how people perceived me. And my boss, having heard that, called me into her office, asked me all of the questions. I answered all of the questions, and then she went out and advocated for me to put an end to that. What happened from that at that time was a sense of relief. But the important thing that happened, and we're talking about this sense of self and the imposter syndrome, is that the next time a bad event was occurring while I was taking care of the patient, I was now stuck with both trying to use my brain to take care of the patient and having all of the metacognition about what this looks like to other people there and what the potential outcomes will lead to and how to manage that. And that is a huge problem, because when you are taking care of a patient, especially in a crisis, the last thing you need to be thinking about is anything but them. And yet I was primed to do that because I felt like I was set up for it from this event the first time. And that is what I went to mentors to. And fortunately, I don't think that one had a bad outcome. But that was a thing that I went to mentors to talk about and talk through. And this is where, Dr. Yost is talking about, you can become a victim of the outcome yourself because it changes you and your ability to function or perform because of the trauma that you experience in either successfully, unsuccessfully, or I don't know whether I was doing the right thing or not kind of situation afterward. And that's a thing that can happen to anybody, and it can happen over and over again, and it needs to be addressed out loud. And sometimes it needs to be addressed beyond mentors and peers, but maybe even with mental health professionals.
Yeah,
That is so interesting. Sorry, Paul. I had a similar event when I was probably 2-3 years out past fellowship, and I had a young patient, I think a 9 or a 10-year-old boy who had chronic illness, had hemophilia, had some other issues going on, was chronically sick, and came in with a big it was a big sinus parasinus infection that had eroded into his nasal artery and basically came in with massive epistaxis. Came up to the OR, had just stopped bleeding briefly as we were trying to get his history and figure out what we needed to do, and then basically let loose, like he let go of his nose and he was filling up a giant cart thing on his bed. Got him to the OR. I don't even think he had an IV. I think he had come right through the emergency room. They sent him up to us, with the usual, well, anesthesia will start the IV. He's got, no cred. He's got no reserve. We missed the intubation, missed it again. We actually probably were in. Because we couldn't see very much. We were going for, he was actively bleeding while we were trying to intubate. He had an abnormal airway. He was fairly anterior. I actually, in retrospect, think we probably did get the tube in, but because he had so much blood in his lungs and so much bronchospasm from his underlying disease, we weren't getting end-tidal CO2, so we kept taking it out. Ended up getting a front of the neck procedure, which went sideways because, as many of you know, in young children, it's a very challenging procedure. Got a ton of pneumoperitoneum, pneumochest. In the meantime, we're trying desperately. I think we had one little IV. I think we had a 24 gauge in him. Got another IV, was able to send a crit that was like 10, was trying to get emergency blood and squeeze it through this little tiny IV. We did just as Dr. Markowitz said, we actually got Rosk. We got him to the ICU. The family ended up choosing to withdraw care several days later. But that was devastating for me. I mean, I remember being curled on top of the staircase at my house, sobbing on the phone to my former chief of trauma anesthesia, who it was someone I felt very close to at my previous, at the hospital I trained at, basically in Houston at Baylor. I just remember just sobbing and sobbing. I couldn't even get the words out. I was crying so hard. I think I was blessed in that I was so internally devastated by what had happened that I really wasn't able to focus on any of the other communications outside of it. So by the time I was able to really within myself, but as I think Dr. Yost implied early on, it took months. It took months to really feel like back on firmer footing again. That I wasn't aware of what people were saying about me or what they could have, what they said should have been done differently. I don't know if people said anything, actually, quite frankly. They may have, but I was not aware of it because I was so focused in on this. But it did make me really hesitant, and I called him many times. It was more than just that one conversation. And I talked to my colleagues that I worked with there, and I talked to lots of other people. But he was the one in my mind that I needed the blessing from, that you did everything you could. And I mean, I remember him saying, "What could you have done differently?" And I'm like, "I could have gotten the tube in on the first try." He's like, "But in what you could see and what you could do, is there anything you could have done to optimize that situation?" And it didn't sound like it. He had a huge swollen airway and pharynx and all of this stuff. So, I mean, talk about imposter syndrome. That lasted for a long time. So, anyway, we're off track. Does anyone else want to say anything else about imposter syndrome before we move on to the next topic? Because we
I, I
are.
would I would just say,
Go
well, like
ahead.
I really like what Scott had to say, because it's definitely happened within our group where someone does have, early in their career a difficult outcome, and then they feel less secure, they feel less sure in what they're doing, and it just seems to beget more criticism. And you really need a good mentor to intervene and to advocate on your behalf, because it's very difficult for you to defend yourself. You need other people defending you and feeling like they are. And seen that happen a few times, and I wish we could have done a better job in a couple of those. I think that's really key to maintaining people's mental health and
I just want
well-being.
to say something about a book that I read that I'm actively reading, The Trusted Advisor. And I was having this conversation with Scott beforehand. There was a paper in ANA about anesthesiology, and the trusted advisor was a large part of that paper. And it talks about, these mentors, these advisors that we go to, we have to have some sort of relationship. They're credible, they're reliable. So we approach them with these really difficult situations. And that actually helps build a more intimate relationship, in that, like, we've shared something that's very sensitive, that's very emotional for us. And that actually builds that relationship even better. And then they come back and they say that, they're self-oriented, in that they can put you back at the level that you need to be, right? They can lift you back up, and it's not about them getting something out of that relationship necessarily, but it's more about them being there for you. So, I'm really happy, Rita, that you were able to have that advisor and to be able to identify that person that you can call when you were in that really terrible situation.
Thank you. That was great. Well, and I love that quote that they can put you back where you ought to be. That is lovely, because we do tear ourselves down a lot. We are often our own worst critics. I want to, as we're getting shorter on time, I want to pivot to a couple more questions really quickly. And that is, how can early career anesthesiologists find mentors, whether it's for, that they want to pursue leadership, or whether it's for promotion if you're in an academic setting, or just other types of career fulfillment if you're in a private practice setting? How do people find them, especially, I would say, someone who's transitioning from residency to a new job, and perhaps in a new location where they don't? I think it's much easier when you're staying at the place you trained, because you know a lot of those people already. But when you're moving to places, how do you find those people for yourself? Because again, mentorship programs where you're matched up with people are great, but they're only one part, I think, of the complete picture of who we refer to and who we talk to. And I will start with Dr. Pasca.
So, again, I was able to identify specifically within the CSA a lot of people that I looked up to. Immediately, Rita, I mean, I don't think you remember the first time I met you, Rita. We were actually walking out of ASA. We were on the sidewalk crossing the street, and you were telling me about your kids, and you were telling me about all these things that you're involved in. And I kind of looked up to you, and I was like, oh my gosh, I want to grow up to be just like her. So, I mean, to me, it was like, it gave me palpitations even to get to talk to you, Rita. It was so incredible. And then, getting to sit on these committees with you and, watching you create these podcasts and create these, very meaningful and impactful projects. And then also bringing me into it. So, sponsoring me to also be part of your projects has been really incredible for me. And that's, part of me, again, saying yes to everything, every opportunity that's out there. At some point, I'm going to have to peel back because at some point, I'm not going to be able to keep saying yes to everything. But so far, it's been pretty great.
Oh, great. Well, thank you so much. I actually had no idea. And so I just want to sort of confirm what you said, and that is, if you found mentorships through your state organization, the California Society of Anesthesiology, and through the national organization, the ASA. So you were not finding mentors at the places that you were working. Is that correct?
I wouldn't say that, Rita, because again, these mentorships, they're these relationships, right? Probably not as much sponsorship. I think more sponsorship, which is very different, happened at the state and national organization level. I still had wonderful people within my organization that I was able to reach out to, that I could get advice from and have those relationships with. But I think the sponsorship happened more so at the state and national level.
Great. Dr. Markowitz.
Well, I certainly agree with both of those. I think that organizations that are state component societies or national organizations have the opportunity to help us with a larger pool. The people who are members of those organizations are very often people who are seeking mentorship and people who want to develop and support others. They are looking for making the specialty better. They are looking for solving some of the issues that we have. And I think that that is a really great, rich environment to find someone or people with whom you fit. Also, affinity groups would be an area of recommendation. One of the reasons why the Women's Empowerment and Leadership Initiative was created was because there are so many people who really need and would benefit from a gender understanding advisor relationship. And they're not universally present in groups and departments, even though you may have the ability to find people who can mentor you in other areas. And so to have that, even a team of mentors, including people who can really understand where you're coming from. And Dr. Pasca and I were talking about this earlier, that ability to build that trusting relationship, to have that trusted advisor, can be greatly enhanced by someone who has some overlap of the most significant lived experience issues that you have. And that's not always possible. And so the other thing I say is that there are times when you're inventing your own path. And Paul, I'm guessing you're going to speak about that. When you're inventing your own path, there may not be someone who's walked in those shoes, or you can follow their footsteps. And in that setting, you may need multiple people, and you may also need a professional coach, someone who doesn't have the content expertise, but can help you direct yourself into growing into the space that you intend to inhabit.
Dr. Yost?
Yeah, it's challenging. I think going toward the organized medical societies like CSA, Orange County Medical Association, CMA, AMA, I think you tend to find more service-oriented people and people that are more sort of servant leader types. And I think that that's really helpful because you don't always find those people in groups. You may find a lot of people who are trying to keep their head above water and pay off their student loans and survive. But I think looking for people who are service oriented, who are servant leader types, I think is probably the best way to find people that are willing to help and able to help because they understand that mentality. So I guess that would be my best advice. But I like the idea of going to organized medical society just because that's where I went and that's where I found mentors and leaders and people who helped me along the pathway.
So I was gonna, so that kind of follows up from that, and I think you've all sort of answered it, but I just want to see if you have anything else to add to the question. What if there is no mentor available? And that's really if there's nobody like where you work or in your practice setting that you feel like would be a good mentor for you. I think I've heard it from all three of you, but I just want to give you all a chance to say it again. Dr. Markowitz, we'll start with you.
Well, the first thing is please don't give up. Keep trying, keep looking for people, and also change if you need to what mentor looks like to you. Don't be limited because you're only looking for someone who matches gender or age or other background expectations that you have. Seek out people who will do for you what you need. There are also peers. So having someone who isn't a content or pathway expert, but can help with bouncing things off of, encouraging, maybe even helping hold me accountable. Those people can be incredibly valuable, and they may even be able to do some of the elements of sponsoring, like making introductions, connecting me to another network, or a suggestion that could be helpful as a mentor advisor.
Dr. Yost?
Yeah, I don't know if I have an intelligent answer to that beyond that.
No, that's fine. That's perfectly fine. You've already said it. I just wanted to make sure you didn't have anything else. And Dr. Pasca, do you have any other comments about if you can't find a mentor or if you don't think that there is a mentor? Because I hear that a lot. Well, I don't have any mentors. I don't know how to find a mentor.
So there's actually a lot of leadership training programs that you can join through the ASA, the CSA, that are specifically meant to develop you as a leader. And there's tons of mentors to be found there. When you talked about not being able to find a mentor, I actually remembered one student. I work with tons of students. Every year I work between 50 and 100 medical students who come for letters and for case reports and building their CVs. There's one particular student I just couldn't work with because she wouldn't show up. Like we went back and forth with 3 or 4 emails. She just wanted me to give her some project, didn't want to show up, didn't want to meet me, didn't want to come on my own terms. She was busy with rotation, she told me, which is great, but I can't exactly help you if you don't show up and, do some things that I ask you to do. And so I really felt like I had let her down. I never met with her. I never did any of the things that I give freely to all the other students.
Well, great. And you've all talked about it. Well, actually, before I answer that question, I'm going to ask one last question, I think, and then ask for the difference between sponsorship, mentorship, and coaching. But before that, how does a person know if the relationship between the mentor and mentee is working? How do I know as a mentor if our relationship is working? How would someone as a mentee know if their relationship is working? And I'll start with Dr. Yost.
Sure. I think that because they're fitting in, because they're successful, because they're able to work in that environment. They're able to focus on doing cases and on the work that they're doing and helping the patients and taking care of the patients. And they're not focused on how they're being viewed. They're not self-conscious. They're able to perform to their highest level within your system and to be productive and happy and healthy. And I think that's how you know. To me, that's the objective measure that it's working is the actual outcome.
Great. Thank you. Dr. Markowitz.
Agree. And I'll add to that are they helping you feel clearer and more resolute about your goals?
Okay. Okay. That's you as a mentee. You would feel the relationship is working if you feel like your mentor is making making your goals clearer, making you feel more resolute. And then Dr. Pasca, either as a mentee. Oh, go ahead. Sorry.
Yes, I was agreeing with you that
Oh,
the
okay.
mentee needs to drive the relationship and set the goals, but the mentor needs to be there to help the mentee refine the goals to make sure they're working on what they want, and they're taking steps that get them toward it.
Okay.
The
Excellent.
mentee has to feel that.
Has to feel that. Okay. Dr. Pasca.
I just want to caution, Rita, that you don't try to have one mentor and expect one mentor to fill every need. I believe that all of us have tons of mentors. And so when you say that you don't have a mentor, really step back and really identify with a sort of gratitude all the people that have helped you along your path. Those are your mentors. Those people that have helped you, that you have built a trusting relationship, that you've reached out to, that helped you, build your CV, wrote letters of recommendation for you. Those are really people that have already invested into you. And so just recognize what people have already done for you, and first and foremost, and then what you've gotten out of those relationships, whether it helped you get into a residency, into a new job, whether it helped you, you know, to overcome this imposter syndrome. Just there's so many rich things that mentors provide for us. And I think the limitation is really in us understanding what a mentor is.
Oh, that's great. Thank you so much. And then what do you think? I actually have two more questions before we do the final definitions. Do you think it's better to have a gender concordant mentor, or do you think it matters? And I'll start with Dr. Pasca on this one.
Yeah, so that women leadership paper that I referred to earlier, actually the vast majority of the women had male leaders, especially as only about 16% of chairs in anesthesiology are actually women, depending on where you want to end up and whether you even know where you want to end up. There's not that many leaders that might be in the next level where you want to be. So I don't think that it matters. I've had wonderful male mentors, wonderful female mentors, and I don't think it matters.
I'm going to ask Scott next because I'm hoping he'll push the Welly initiative again, because I think I'm just in awe. And full disclosure, Scott is on the steering committee for Welly, and I'm one of the mentors, or what am I called? I'm not actually a mentor.
Advisor. You're an advisor, and the
I'm an
advisors
advisor.
well use coaching skills as well as other mentoring techniques. WELI, the Women's Empowerment and Leadership Initiative, is in the Society for Pediatric Anesthesia. And the model there is that advisors can be men or women or people of other gender. And that setting is mostly because they try to match on a variety of things. But if a protege within the program would particularly like a mentor who's a woman, then we will go out of our way to make that one of their relationships in there. One of the things, just to reiterate is, don't look for one perfect person. I agree with you, Dr. Pasca, that you're going to need more than one person anyway. And so, you may find people who have lived experience that matches in one area, but don't have the work experience that you need in a different area, and so on. And also that one of the things is that these relationships take time to develop and to really come to fruition. And so, don't be too quick to judge someone as not a good fit, and don't wait too long to judge someone who clearly isn't in that setting.
Dr. Yost, what has been your experience with gender concordant or discordant?
Well,
Mentoring or mentee, or being a mentor, or being a mentee?
It's hard because I'm an older white male. Although I have to say that the person who was kind of one of the examples that I had as a great leader was actually female. Was Patricia Kapoor, who was the chair at UCLA when I was there. And she wrote one of my letters of recommendation. And when I became president of CSA, she was my Leffingwell lecturer. But she was amazing. She was chair of the ABA. She could have been ASA president if she had wanted to, but she didn't want to. But she was, an incredibly, powerful, strong, woman and leader, and it's an example for me. And I don't know, but then I'm not female, and I think that there are, without a doubt, implicit biases that happen. And I think having someone who is aware or senses those because they are part of that group, I think is probably incredibly important for some people. For others, it may not. But I think it's also true that you do have many mentors. And I think having at least one that is as similar to you and your life experiences as humanly possible is probably really critical for people.
Great. Thank you so much. Thank you, all of you. Who would like to tell the audience what the difference is between sponsorship, mentorship, and coaching? I know that Dr. Markowitz is a certified coach, so maybe he can take that one on. Dr. Yost or Dr. Pasca, do you want to take on what the difference is between sponsorship and mentorship?
I touched on that briefly earlier. So, mentorship is someone who helps sort of build your trajectory, supports you in any area that you feel is inadequate or needs extra support. But a sponsor in particular will give you the opportunities for development. So, things that build your CV and build your careers, talks, papers, book chapters that you can do, those are sponsors.
And Dr. Yost, how does that work in kind of private practice and getting ahead in the national and regional organizations that you've been so successful with?
It's a good question, and I'm not sure I know the exact answer. I really don't. I've had mentors and I've had sponsors in some way. I've had people that preceded me. There was a person who was he was the district director before me. He was head of legislative practice affairs before me, and so he was sort of blazed the path and got me interested and got me involved. And that was Dr. Pauker. And so I think we have people who are kind of like that. I wouldn't say that he sponsored me per se, but he was an example of a certain direction to go, and he encouraged me along the way to do things and saw things in me that I didn't necessarily see in myself. So I think that's critical and important.
Yeah.
But I'm not sure I know the full answer to that question.
Okay, that's perfectly valid. And Dr. Markowitz, do you want to talk a little bit about what coaching is and how that can be helpful and useful?
Sure. There are two ways to look at coaching. One is with a professional coach, and one is using coaching approach and coaching skills within another relationship. So mentors sometimes use coaching techniques in their interpersonal interactions with mentees or proteges. And in that setting, they have the ability to make sure that the protege feels empowered, that they are driving the relationship, that they are driving the goals, that they are really being heard and seen. And the mentor in that setting might use coaching skills in some settings rather than giving advice or teaching something. In terms of professional coaching, one of the things that happens is that a mentor is someone who's already walked the path that you want to walk and can give you good advice from that perspective. And if they're not gender concordant, they can at least be humble enough to recognize that your path may look different or have different steps than their path did. And so that's a really great thing. But there aren't that many people who really are that ahead of us in that area who can really tell us how to get to where they are. Especially now, the world changes so fast that even if they're only 10 years older than me, it's a very different pathway that I need to follow than they did 10 years earlier. And so in that setting, how do I move into unknown areas, or how do I move with additional help into areas that other people can't really advise me on? And the answer to that may be things like professional coaching. The coaches use a process rather than having the information to help you work out how you're going to figure out what the goal is, how to get there, what processes you use personally to learn to get there, how you're going to measure your progress along the way, who you're going to enlist to help and support you. That is, what relationships do you have and what relationships are you missing in this setting? And so professional coaching can fill a lot of those gaps. And all big leaders have professional coaches in the Fortune 500 and in most C-suites in health systems now. It's becoming much more used in academic medicine, with chairs all having coaches and vice chairs all getting coaches at my current institution. These are areas in which the cost of the coaching turns out to pay return dividends that are considered worthwhile by the organization. In the future, everyone will have leadership training and everyone will have touch base with coaches along the course of their pathway, so that they won't need quite so much effort when they get to these positions that are both rarefied and high stakes. But for now, that's where we are. So that's kind of the coaching side of it. It's a contextual approach that uses a particular supportive structure that does not require the coach to have the expertise in where you're going.
Great. Well, thank you all so much. Is there any last words of wisdom you'd like to share or impart before we wrap up and stop talking? Dr. Pasca, any last words you'd like to share with the audience?
I just want to thank Rita, and I want to thank the rest of the CSA and Dr. Yost and Dr. Markowitz. Really get involved in your local, state, national societies. Get on committees. Some committees are more difficult to get on, and if that's so, just apply for a different one. I actually had a really hard time getting on the women's committee for ASA. I found it really disheartening. I had applied multiple years and felt like, okay, well, I had done, enough with the CSA to at least, be considered. So if you're in that situation, don't be discouraged. Really reach out to people within your local chapters and find out. Some of those committees are actually really saturated and have a ton. I think they said like 300 women had applied for the ASA committee for women. So there are different ways to get into those leadership roles, and don't get discouraged if initially somebody tells you you can't be on a committee.
Great. Thank you. Dr. Yost.
I would say, just say yes. Like when it was, that's kind of what I've done my whole life. And, just say yes, show up, do the best job you can. And then people ask you to do more. And it's not a lot more difficult than that sometimes. Just say yes and then keep working, find people who are similar to you, do the best job you can. And then before you know it, you're being asked to do more. Of all the things I've done, but even like mayor, chief of staff of a children's hospital, chair, president of CSA, none of them were things I set out to do. They just kind of happen along the way when you do a good job leading up to those things. You just work as hard as you can, and pretty soon you're somewhere where you weren't before.
Great. Thank you so much, Dr. Yost. Dr. Markowitz, you get the last word. Well, I get the last word, but
I get the penultimate word. Thank you, Dr. Agarwal. I'd also like to thank our colleagues here. This has been really wonderful to get to work and to participate in these conversations with you. And Dr. Agarwal, I feel like the last thing that I would like to offer today is that I'd like everybody who watches or listens to this podcast to recognize that in seeing you, they are seeing a person who has been and continues to be an incredible mentor and sponsor for me and undoubtedly so many others. Thank you.
Thank you. You're making me tear up. Sorry. Whew. So this has been another episode of the CSA's podcast, Vital Times. I hope you enjoyed this conversation. We may do more because I think there's still so much to talk about regarding mentorship, sponsorship, coaching. Hopefully we'll do another episode on a similar topic in the future. And thank you again for joining us.